Good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, an affiliate of the Wellness Way right here in Yorkville, Illinois, right outside of Chicago. Hope you guys are having an awesome Monday evening. I apologize for coming on just a little bit late. I ran a little bit late with consults and finishing some things up. But I'm here and I'm ready to spend some quality time with you guys. If you guys are joining us, please let me know where you're watching from. I always appreciate that. Guys, I'm going to add something to it. If you are currently a Wellness Way patient with myself or with other doctors across the country, please do me a favor. Please put a green heart, okay? Please put a green heart. If you are a first-time watcher, go ahead and put a red heart. Doesn't necessarily mean that you love me, but just allows me to know all the new people that we have. I think we have over 13,000 followers for this, and I appreciate every single one of you. I always appreciate your comments. I always appreciate the number of shares and everything. So thank you guys again from the bottom of my heart. I actually didn't think that a lot of people would want to see this topic about AFib. Only because it's a pretty special topic. Someone had requested it. I thought for a second, I do see a lot of this in clinical practice, but it really doesn't have a lot to do with, weight loss or gastrointestinal issues or, things like that. So I thought, maybe this might be a little bit more of a specialized topic, but the number of people that responded or reached out to me were like, oh my gosh, I need to hear about this. Maybe not for myself, but I know someone who has atrial fibrillation. And I want to share this with them. So I'm going to give it, guys, my best shot. I have seen this in clinical practice. Guys, I will tell you, I'm going to give you a completely different perspective when it comes to the heart. A lot of times, in medicine, they think it's a heart issue. And I'm going to tell you right now before we get started, this is not a heart issue, okay? Yes, you're having the symptoms of the heart, but it's kind of like, if you step on a dog's tail and you get the symptom of its teeth, turning around and biting you in the ankle. So the heart is the consequence, but I'm going to tell you what one of the causes is. Actually, what medical doctors say, and from the medical literature, however, if you were to be diagnosed with this, I'm going to show you that really what they treat is they don't treat the cause, they treat the effect, which is actually the heart. So let's go over a different perspective when it comes from AFib. I'm going to go over with you what it is. I'm going to go over with you common treatments, who's at risk for this, and I'm going to show you, here's, guys, what you need to look at. And guys, if this makes sense to you and you find value with what I'm going over, please share this with other people. Please tag someone who needs to hear this, or please share this on your timeline. Again, I'm always grateful when you guys do this. This is one of the things that keeps me going, is to know that I'm making a difference in your life, and I'm also making a difference in a lot of other people's lives as well, okay? So when it comes to AFib, or atrial fibrillation, is really what it's known as. I went to WebMD because this is where a lot of people are going to try to find their information. When they search Google or DuckDuckGo, they're going to go onto, and usually the first thing is going to pop up is WebMD. Why? Well, because they pay for the placement of it at the top of the search engine. So here's what WebMD actually says. Now, I'm going to say something that might be a little bit funny when I go through this, because people have complained to me, which I don't understand. They say, oh, you're talking in layman's terms, you should talk more like a doctor. And I say, I'm trying to talk to people in a way that they can actually understand, and you're actually going to see that WebMD tries to do the same thing, okay? So WebMD says this: what is atrial fibrillation, okay? Atrial fibrillation, or AFib, is a quivery, fluttery heartbeat. The doctor may also call this an arrhythmia, or a lack of rhythm of how the atrium, atrium and the ventricles, okay, of how they're contracting. Guys, if you look at how the heart works, the top part beats first. When you hear a heartbeat, bump, bump, it's the atrium that squeezes into the ventricle, and then the ventricle squeezes that out. And where it goes to is, on the one side, it goes to the lungs to oxygenate, and then it gets pumped back to from the lungs back to the heart to get dispersed into the rest of the body, either going up the head or actually going down into the extremities. So here's what they say. Blood can also pool in your heart and form clots. That's why doctors are scared to death of AFib, If one gets stuck in your brain, you can have a stroke, which is why they put so many people who have AFib, they put them on blood thinners, okay? Now, what happens in AFib? Normally the top part of the heart, the atria, squeezes first, then the bottom part, the ventricles. So it goes bump, bump, and the ventricles squeeze going to the lungs to oxygenate, and then it comes back to the other side of the ventricle, and then that gets dispersed as oxygenated blood throughout the rest of the body. Now, when you have AFib, the electrical signals that control this process are off kilter, okay? Now, they say something that's really amazing, okay? Is they say electrical signals. Notice how they don't say anything about it being a heart problem, but it's rather an electrical signal problem. And pay attention to that because this is really, really important. But going back to my funny story, is look at what they say. They say off kilter, quivery, fluttery, heartbeat, okay? So yes, even WebMD tries to put it into layman's terms. And so if I try to put things into layman's terms, I'm just trying to help you guys to understand, okay? So what is it? It's having an irregular heartbeat, otherwise known as arrhythmia, which means is as a result, you're going to have a hard time pumping blood either to the lungs or getting blood dispersed to all the oxygenated blood dispersed to the rest of the body, okay? Now, one of the complications, yes, it can be a stroke because that blood can pool within the heart, and if it pools within the heart, anytime blood pools has a tendency to want to clot, which is why they don't want you to throw a clot, either go into the brain or go into the lungs or go into some kind of extremity, usually in through the legs, okay? Now, who's at risk for having AFib? Well, I looked at the people who are on specific medications who are at the highest risk, and yes, it can be medication related. It can also be due to the conditions that the doctor wants to prescribe you medications for. So one of the first ones is, are you at risk if you are taking a diuretic? The most common one is called Lasix, okay? Now, if you're on a diuretic, chances are is you have like blood pressure, and what doctors think is, okay, well, we can just strip the body of a lot of excess swelling, and that will help to lower your blood pressure. The other thing too is people who are on PPIs. Nexium and Prevacid are the most common PPIs, or proton pump inhibitors. These are things that people take actually for reflux. What's interesting is when we say, well, why do people are taking reflux medication? Why is that? Well, reflux medication lowers stomach acid big time. And anytime you're lowering stomach acid, you're actually going to decrease the amount of mineral absorption. I want you to think of that too, because this is really important. Because minerals, aka electrolytes, are what are needed in order to carry a nerve conduction, to carry a nerve impulse. Maybe that's a nerve impulse that could be going to the heart that's coordinating the contraction of the heart muscle. You also have GI inflammation, ding, ding, ding. Maybe it might be an absorption issue of other things. Anytime the GI system is absorbed, you're going to impair the absorption of specific things. And then also people who have chronic diarrhea. Guys, there's an amazing amount of people who I ask, when is the last time you have had a solid bowel movement? You'd be amazed at how many people haven't had a solid, normal form bowel movement for 5, 10, even 15 years. So if you do have chronic diarrhea, one of the things that you're going to lose is you're going to lose a lot of water, but what you're also going to lose is you're going to lose a lot of electrolytes, okay? Think of calcium, think of magnesium, think of potassium, think of sodium. So it's interesting that we're talking about an electrical signal, and they're also talking about things that can cause a loss of electrolytes or minerals within the body, minerals that are needed in order to have a nerve conduct a signal that is forcing a muscle to contract. So just remember that. Now, also you're going to be at risk. Yes, if you do have reflux. Yes, you're going to be at risk if you have high blood pressure. Yes, you're going to be at risk if you are a type 2 diabetic, and mainly because those people all have these same issues with having problems with reflux, having problems with swelling, having problems with gastrointestinal inflammation. A lot of people who have type 2 diabetes suffer with their GI system as well. In fact, I've gone over in videos that having an issue with what's known as short-chain fatty acid production due to having some kind of imbalance in the gut microbiome can actually lead to blood sugar issues. And I think I did that video 2 to 3 weeks ago as well. So what are some of the symptoms of having AFib? According to WebMD, here's what they say. it feels like your heart is racing or fluttering in your chest, or having what are known as heart palpitations, okay? You'll feel fatigued, you'll feel weak, you might feel dizzy or lightheaded, you might have chest pain or feel chest pressure, and you might be short of breath. So guys, you don't have to memorize all of these different things, because I want you to think about it. If you have a heart arrhythmia, if you're an AFib, you're going to have a problem pumping blood everywhere in your body, including your brain. So if you don't have enough oxygen going to your tissues, of course you're going to feel fatigued. Of course you're going to feel weak. Of course you're going to feel dizzy or lightheaded. People ask me all the time, why do I get dizzy? Why do I feel lightheaded? There's a couple of different reasons why. You might have a lot of gastrointestinal inflammation that's going on. A lot of blood has pooled. Can't get enough blood to the brain, which is going to cause things like dizziness, fatigue, headaches. You might also have issues with dizziness because of your adrenals. You don't have the ability to be able to produce adrenaline or produce enough of it. So any kind of change in position is going to cause, like getting up from a laying down position or seated position real quickly. You can't increase your blood pressure enough, which is going to be lightheaded as a result. It may be a neck and inner ear issue, especially when it comes to the top two vertebrae in your neck. That is a huge source of dizziness, because it's providing most of the proprioception that's going on, or joint awareness that's going back to the brain. And obviously you can have shortness of breath only because you're not getting your tissues oxygenated the way that you're supposed to. So these are some pretty common symptoms. If you have these symptoms, it doesn't necessarily guarantee that you have AFib, but one of the biggest things that people do notice the most is that they feel like their heart is racing or fluttering. They can just actually feel that as well. So when you look at the treatment that WebMD says, here's what's really interesting, because they actually go in contradiction to what actually some of the scientific literature actually says. So here's what WebMD says as far as the treatment. Depending on how severe your symptoms are, your doctor may recommend medication, surgery, or even a pacemaker to get and keep your heart in a normal rhythm. What's interesting is just a couple of pages before on their webpage, they said that this is actually due to an issue with nerve conduction, but then the treatments are all related to the actual heart muscle and not the electrical signal that's actually going to the heart. So the first thing that they're going to do is they're going to put you on medication. So the first thing that doctors are going to do is try to treat the atrial fibrillation with various drugs to try to control the heart's rhythm, or slow your heart down and help prevent blood clots, excuse me, that might lead to a stroke. Now, your doctor can give you drugs that will slow your heart rate and ease the strength of the contractions. These are known as beta blockers and calcium channel blockers. Interesting thing about beta blockers is that, guys, beta blockers actually will block the adrenaline response. And one of the biggest side effects I've seen clinically is that people have problems with dizziness quite a bit. Because remember, they're blocking an adrenaline response, which means change of position, trying to lift heavy things. It's just going to cause not be able to allow your blood pressure to get higher, which means that it's very easy for you to get dizzy and just to feel chronically just like this all the time. Maybe they'll try to get your heart's rhythm back to normal by, now listen to this, sodium and potassium channel blockers. Now we're starting to talk about electrolytes again, and usually they'll put you on things to prevent blood clots, like blood thinners or anticoagulants and antiplatelets, okay? So they're usually giving you two different medications, and it usually takes them a while in order to figure out what's going to work. But again, what they're trying to do is they're usually trying to manipulate your sodium and potassium levels, and at the same time prevent you from getting any kind of clotting whatsoever. Now, here's what they say. If medications don't work, your doctor will probably try one of these to reset your heart's rhythm. I want you to pay attention to this, because your heart is a muscle. And I'm going to say this a little bit later. Muscles don't know what to do unless they're given directions. And directions by what? Well, what controls your muscles? It's actually your nerve system, okay? So you may do electrical cardioversion, or also what's pretty common is known as an ablation. Now, drop a comment if you know someone who's had an ablation surgery, because basically what it is they take a cut in one of your blood vessels, run a small tube through it, and it then goes into your heart. Your doctor will then use a laser, radio waves, or extreme cold to burn off part of the tissue on the surface of your heart that's causing the problem. This creates scar tissue that doesn't pass the offbeat signals, okay? So basically what they're doing is, if something's not working right, let's just go ahead and kill it off, okay? Kind of makes you wonder what the medical treatment is for persistent headaches. So if it's not working, just go ahead and burn it off. We'll produce some scar tissue and we'll try to shock the heart back into having a normal rhythm. Guys, this is just, I want you to remember that muscles are stupid. They don't know what to do. In fact, I talk to a lot of people, who maybe their children or maybe them, they have what's known as a divergent strabismus, which one eye goes one way, the other eye goes the other way. And they go to all this like therapy all the time, or they go and they have surgery, they cut the muscles, and they're like, the muscles aren't working right. And I'm like, yeah, but you got to understand, muscles respond to nerves, which means there's probably been some kind of insult to the nerve going specifically to that muscle. So guys, too many times medicine treats the effect, and for me, even with my training, we're always talking about the nerve system that is controlling specifically the muscles, okay? So complications from AFib. So this is why doctors recommend all of these procedures, because some of the things that can happen, yes, are a stroke. Anytime you got pooling blood, within the heart, that blood can form a clot, which then will go downstream and get stuck as the blood vessels get smaller and smaller in order to oxygenate the tissues, okay? Next thing is can be heart failure. And one of the reasons why is if you're not pumping enough blood to get distributed to the tissues, a lot of times what can happen, guys, and this is also can be a huge thing, especially if anybody has any kind of chronic scarring, scar tissue, chronic inflammation in the lungs, like from smoking, things like that, is you get inflammation leading to scarring within the lungs. It's going to cause more resistance of the heart to be able to beat that into the lungs in order to oxygenate the tissues, which you can have hypertension caused by lung inflammation. Now, heart failure, this can happen because if you cannot get enough blood to be able to go to the lungs, it starts to get backed up, which means you're going to have an increased pressure, which then will cause the heart, it will cause it to even beat less because of all of that pressure. Then obviously you're going to have fatigue, and yes, it's even associated with memory loss, probably because of the lack of oxygenation that's actually going to the brain. So I get it, I understand it. AFib is not something to actually take lightly, especially when it's something that can be a very long-term type problem. Most of the time when people are diagnosed with AFib, they put them on blood thinners and then they put them on some kind of beta blocker or something like that, and it's a lifelong sentence. There's no direction as far as why it happened, what can you do in order to correct it, and it's like all of a sudden, you mean the body is just messing up? I mean, I lived 45 years with a normal heart rhythm, and then all of a sudden it goes bad, and we never ask the question why, other than saying, well, it's probably genetic, or it's probably, just old age. And those are the two most useless things, I'm sorry, that why people give an excuse, because it requires no thought, it requires no questioning, and the doctor it's almost like their standby answer to everything. Guys, always ask the question, why? If you don't want to know why, then continue doing the medical approach, which will leave you no better as a result. Okay? If you do want to know why, then keep listening, because I'm going to give you my opinion when it comes to why people are in AFib and what you can do in order to start correcting the problem. Okay? So you're probably asking this question. I know all the time. I did a video on TikTok about weight loss for women and your liver. If you guys don't follow me on TikTok, you can go to Dr. Nathan Thompson and follow it. And so I said, hey, your liver's a problem. And people yell at me because I'm not reaching out and giving them some kind of answer. And the reason why I don't give a lot of advice when it comes to things like this is because the advice I give is very specific to the testing that I recommend. And so what people want is they want a protocol. Guys, there is no protocol that I use. And in fact, if you ask my staff, when I go up and I finish up a consultation with people, everyone looks different. Everybody looks different, even if they have some of the same symptoms, because everything we do is based on testing. And again, we don't test for fires as much as we're testing for causes. So doc, what can I do? Well, I'm going to show you where you need to start looking. And guys, if you are not working with a Wellness Way doctor, then please reach out to thewellnessway.com and you can find a doctor to work with. Right now, I'm not working with any more people remotely. We are seeing people in person, but there are doctors who have the ability to be able to work remotely, who have a little bit more capacity than I do at the moment. But yes, we are taking new patients if you are local, and I have the ability to be able to see you in person. But let me give you some tips, and let me give you some ideas, and let me help you to start thinking a little bit differently when it comes to AFib, okay? So just like I said before, guys, muscles are stupid. They are. They don't know what to do. And guess what? Your heart is a muscle. I remember I was having a conversation with a gentleman today who's been suffering unbelievably. You know, he's in his mid to late 60s for about a whole entire year. Terrible, terrible bloating, gastrointestinal issues, is having muscle weakness, terrible muscle pain. He has now been recently diagnosed with Parkinson's disease. And one of the things that I saw is I said, hey, you're taking a statin drug. I'm like, did the doctor tell you about some of the side effects of taking a statin drug? Other than having low testosterone. But one of the side effects is having extreme muscle fatigue and muscle pain. I'm like, you do realize your muscle is also a heart, which if you actually look at one of the side effects of statin drugs, it's depletion of CoQ10, and you need CoQ10 in order for muscle contraction, which, by the way, one of the side effects of taking a statin drug is actually heart failure, and no duh, because if the heart can't beat as strong, you're going to start to back up the blood. So muscles are stupid. They don't do anything unless there's a signal from the nerve system in order to work. This includes your gastrointestinal muscles. This includes your heart. This includes your skeletal voluntary muscles. It includes everything because muscles work based on an electrical nerve signal that's going to it. I'll even take it a step further. How many people say, oh, I have tight muscles and I need to stretch? Guys, muscles are going to contract. Muscles are going to go into spasm because the nerve system says it needs to be, and usually the nerve system is trying to do that because there is some inherent weakness that the body is trying to protect you from. So when we think, oh, I need to try to relax this muscle spasm, I'm like, don't try to relax that muscle spasm. Your body, your nerve system is way smarter than you. It's way smarter than your doctor. It's way smarter than me. So when people are having issues with tight muscles that they think they need to stretch all the time, yes, you can temporarily override the nerve system signal only to in a couple of hours say, wow, my muscles are really tight. Guys, if you want better mobility, you want better flexibility, actually moving will give you better mobility and better flexibility. If you want to become a better squatter, you don't have to stretch all the time as much as start working on squatting. Your muscles will then adapt to that stimulus. So getting back to the heart, when I say that muscles are stupid, the heart's pretty stupid too because it's a muscle and it will not do anything unless it is receiving a nerve impulse to contract. Guys, AFib is not a muscle issue, it's a electrical conduction issue, if that makes sense. So I'm going to give you a different perspective because really what you have to do is you have to look at the circuit board. The circuit board, the fuse box that then is sending the electrical current to the rest of your house, okay? So your fuse box in your body is actually the brain, and it's actually the spinal cord protected by the spine. So you have to look at the fuse box to see what could be happening with the electrical signal that could be going to the heart. Does that make sense? If that makes sense, please give me an amen. So a lot of times, it's almost like if you are turning on a light and it keeps burning out all the time, at some point you need to say, you know what? Something might be wrong with the ballast, something might be wrong with the electrical current, something might be wrong with the fuse box, and at some point you got to just stop replacing the light bulb every 4 hours because it could be something else that's going back to here. So you have to trace it back to the source. So when you talk about AFib, I'm going to tell you one of the first places that you have to look is trace it back to the nerve system, okay? Guys, this is one of the biggest reasons why we take x-rays in people. A lot of times people say, I want you to help me with my gastrointestinal system. And you think that it's all chemically related, it's all related to nutrition. And yes, there is a component to it. But the only way to know if there's a neurological component, a chemical component, or even a mental stress component is to make sure that you are testing all of those different areas. So here's an x-ray, for example. When you look at this, here is a young girl, and you can actually see that there's what's known as is an extreme upper angle between her skull and between the top bone in through her neck. What's interesting with her is that she actually had what's known as a divergent strabismus, one going one way, the eye going the other way. You can see, and the reason why is this area up and through here, the occiput, is actually protecting a lot of the vascular supplies affecting the cranial nerves within the cranial vault. And so, you know, a lot of it can be tied back to things like birth trauma or, you know, extreme trauma when someone is very young, or even car accidents and things like that. So you can see when you look at this angle up and through here actually affecting the skull, because where the brainstem comes out, the doctors call that the mouth of God, because that's where the intelligence comes out from the brainstem. But if you look at the main nerve that is associated with the vagus nerve that is involved with rest and digest, that allows the heart to be able to slow down. And then you also have what's known as the sympathetic chain ganglion that's on the outside of the neck that speeds it back up. This is neurology, but what's interesting, guys, is that the vagus nerve right here, you can see as it exits the cranial vault, and it sits right next to the top bones in through the neck. So you start getting some kind of injury to it, you start getting some kind of rotation, you get some kind of shift, you are going to either stimulate or inhibit what's known as the vagus nerve. And so this is not a new concept, because when it talks about calming someone down, when they talk about autoimmunity, when they talk about AFib even, they're talking about the vagus nerve. I'm going to show you in just a second. And so this is why vagal nerve tone is so incredible. And this is why you get some of these miracle stories when it comes to chiropractic, because what doctors can do is they can reestablish normal vagal tone. And all of a sudden when that happens, you'll see the heart start to go back to normal. You'll see rest and digest go back to normal. Digestion gets better. You will see that acid reflux gets better. Heck, we've seen people's blood sugar go down 150 points as a result of helping people get into rest and digest from a neurological standpoint, okay? So here is what they said from MedPage today. This was about 2 years ago, almost 3 years ago, this came out. Here's what's really interesting, guys, because medicine is now trying to use the vagus nerve in order to help people to heal. So in this article, ear clip nerve stimulation may reduce AFib episodes, okay? Now here's what they did. They provided low-level stimulation via a clip-on electrode at the tragus, which is this thing right here, of the ear for 1 hour daily, and it cut the percentage of time of people in AFib over a 2-week continuous monitoring period by a relative 85% after 6 months of treatment compared with the sham stimulation treatment. So they improved a person's time in atrial fibrillation by 85% by stimulating the vagus nerve via their ear and helping them get into rest and digest. Now, here's the problem. If you stop putting that clip on the ear, AFib is going to come back. What that means, though, is that they're trying to override the vagus nerve and trying to stimulate it to help them get into rest and digest. We don't want to put things on the ear as much as we want to correct any kind of postural distortion when it comes to the upper part of the neck in relation to the atlas and how it sits on the skull. But they're proving it right there, guys. Look up, do a web search on vagus nerve stimulation, and they will talk about things like AFib. They'll talk about autoimmunity. They will talk about so many different things, because remember, guys, your organs don't know what to do unless they have some kind of nerve stimulation that's going on, which is why you cannot, when it comes to this and many other conditions, you cannot rule out the role of the spine and the nerve system when it comes to sickness, illness, and disease, okay? Now here's the other thing too. So not only can you not have any kind of abnormal pressure or any kind of abnormal stimulation of the nerve in relation to the spine, but the other thing is too, is you got to think about what conducts a nerve transmission and what produces this electricity in the nerve. And I'm going to tell you something, what does it are actually electrolytes. So if you go back and you look at nerve physiology, you have what is known as a sodium-potassium pump that helps to transmit what's known as an action potential along a nerve that will then stimulate the release of neurotransmitters and then allow that next part of the nerve to continue with this nerve conduction. This is sodium and this is potassium, and there's other things as well that are involved with regulating the intake of sodium and potassium in and out of the cell. So what happens then if you are deficient in minerals, if you're deficient in electrolytes? Well, you may notice that if it's in a skeletal muscle, have you ever noticed that you go into spasm? You might have cramping, or your muscles may flutter. Now, so many times we'll say, oh, you're probably mineral deficient. Maybe you should take some potassium. Maybe you should eat a banana, which is not the best source of potassium, by the way. And then you're like, well, that will help correct some of the issues with this electrolyte balance. There's a lot of people who have a loss of electrolytes or don't have enough electrolytes as well, because a lot of times some of the things that you will feel is you probably will feel a lot of tightness and spasming in your calf, maybe in your arms. Your eyelids may flutter a little bit. You may have some issues with IT band syndrome, maybe even plantar fasciitis. That's usually can be attributed to a magnesium issue. So guys, so many times when I look at people, we will dump so many minerals in them when they're starting off because they're coming in and they're so mineral deficient. So look at this right here, guys. Look at potassium. How much potassium do you need every single day? And it's between 3,700 and 4,500 milligrams. That's a lot. And I'm going to guarantee that you that are watching right now probably don't get enough of potassium. Well, Dr. Nate, where can I get my sources of potassium or sodium or magnesium? Specifically potassium and magnesium. Guys, if you want to make it really easy, if it grows from the ground, it's going to have some level of minerals, okay? They pull it from the soil and it ends up in the food. So, but there's certain foods that are going to be better in potassium, there's certain foods that are going to be higher in magnesium, and there's foods that are going to be higher in sodium. So when you think about potassium, 4,500 milligrams is quite a bit, and guys, you probably will need more if you're sweating every single day and you are working out. I have to get a lot of potassium because you will lose these electrolytes when you sweat, which means you're going to need more of them in order to replace some of what you're losing when you're working out. So think of potassium, all right? Think of sodium. Best source of sodium is going to be unrefined sea salt or pink Himalayan salt. I tell a lot of people start taking a whole teaspoon per day. And then even magnesium, guys. Magnesium is absolutely huge because it plays a role actually in what the sodium potassium pump along that nerve cell membrane. So magnesium you don't quite need as much, anywhere from 400 to 500. I've had some people take 750 to 800. Sometimes we'll have people take magnesium because it will stimulate smooth muscle contraction, which will help you move your bowels if you're in a pinch and you need to have a bowel movement because you're constipated. So you guys need to increase your potassium. You can do an easy Google search in order to look at best sources of potassium, best sources of magnesium. But a lot of times with people, we will supplement with potassium pills. We will supplement with magnesium. Another name for it is called Relax. And guys, I will actually give you where you can go. You can go to store.wellnessway.com. In fact, a lot of times I will take 5 to 10 potassium pills every single day. If you are feeling fatigued, run down, you don't have a lot of wind and tired, sometimes the problem can be due to a lack of potassium. But guys, if you had diagnosed an atrial fibrillation, my goodness, you need to start increasing probably your stomach acid with absorption, but increase your minerals quite a bit. I know that someone's going to say something. They're going to say, yeah, but my doctor said because I'm on X medication that I shouldn't get any extra potassium. And I'm like, maybe that's why you've been taking that medication for 15 to 20 years, okay? And the thing that I will always say is so let me get this straight. Your doctor says not to take potassium. Would he or she also say not to eat any green leafy vegetables that are high in potassium as well? Would they say try not to eat so many veggies because they might be bad for you and they might interfere with the medication that I'm taking? So some of the advice is absolutely crazy because they're saying don't do this because it'll interfere with this medication, but the thing that you need to do will actually help you not need the medication in the first place. So you need potassium, you need sodium, you can get it in sea salt, pink Himalayan salt, and then magnesium we'll recommend it for people in the form of what's known as Relax, which is a magnesium powder. You do magnesium, it actually helps with anxiety, it actually helps with muscle contraction, it helps relax fascia, and magnesium helps quite a bit with sleep. It relaxes you is what it does. And then this one right here, NDPW. NDPW, maybe we should make that a t-shirt. But NDPW stands for never drink plain water, all right? We're going to say something to all the nutrition gurus out there who say you need to drink 120 ounces, 150 ounces of water. I will tell you this, guys, if you drink that much water without any kind of minerals, you will become mineral deficient. There's just no doubt about it. So yes, water is important, but what's also important is what's in the water, which is why if I drink water, there's going to be minerals in it. So I actually take something from Key Nutrition, and it's an electrolyte powder that has already potassium, has sodium, and it has some magnesium in it. Guys, you can get it from Amazon.com. Key Nutrients or Key Nutrition is what it's called, and it's flavored with stevia, so it tastes like lemonade. It's really good. I love it. Everybody asks me, what are you drinking? That's what I'm drinking. Never, ever drink plain water. I don't care if it's a registered dietitian. I don't care who it is. Never drink plain water. Guys, you can get water from so many different sources. You get it from your food. You get it from vegetables. You get it from fruit. And you also, if you are going to do it, then drink it with some minerals that are going to be attached to it, okay? Now, here's what's interesting about magnesium as I wrap this up. So this comes from cardiology research and practice, and I just came across this before. That's why I was a little bit late coming on. Prevention of cardiovascular disease, screening for magnesium deficiency. So in this article, they're actually saying, hey, cardiologists, you guys need to be screening for magnesium deficiency, which is pretty much almost everyone. But here's what they say. Prevention and treatment of cardiac arrhythmias are the most widely accepted indications for magnesium use in daily clinical practice, since magnesium deficiency can disrupt the homeostasis of intra and extracellular ions, leading to prolongation of QT segment, ST depression, and T waves characterized by lower amplitude. What are they calling? They're talking about when they are measuring the heart rate and the heartbeat, the amplitude of that when they're doing that, okay? So they're actually saying magnesium is a major reason why you're having problems with heart arrhythmia. Now, they further reference the Framingham Heart Study, if you ever heard about that, which is a wildly popular heart study, highlighted how in the comparison between individuals belonging to the lowest quartile, or 25%, or the upper 25% of serum magnesium, the first group was about 50% more likely to go into atrial fibrillation than the latter. 50% more atrial fibrillation when you are magnesium deficient. And let me ask you a question. When you go into have atrial fibrillation, how many times has the doctor looked at you and said, you should probably see what's happening in your vagus nerve? You probably should look at if you are mineral deficient. And so what we want to do is we want to help you have more sea salt. You should be taking a lot more potassium. You should be taking magnesium. We should be looking at those three things. Let's start working on that. Oh, and by the way, fix your blood sugar issue. Fix the fact that you have a fatty liver. Fix those issues and start working on your lifestyle. And then we'll consider, going on a blood pressure medication, a blood thinner. And then as a last result, if you are unwilling to do that, then by all means, we'll go ahead and we'll do a cardiac ablation. But what's happening? People are giving no hope. They're given no cure. They're given no direction. And instead, they're running them into surgery and they're giving them medications that they need to take for the rest of their life. Guys, I am passionate. I am passionate about keeping people out of the hospital. I am passionate about keeping people off of medication because there's not one person that says, my life is so much better now that I'm on 19 medications. I couldn't run a marathon, but you know what? I went on those 19 medications, and you know what? I ran 5 marathons last year. My life is so much better. All, guys, a medication is a permission slip for you to continue living the same destructive lifestyle that got you sick in the first place. Yes, there is a time, yes, there is a place for medication. It's called fire department care. But if you are continuing to use fire department care as your health care, then the only thing that happens is that you will live longer, but you will live longer sicker and miserable. And that's not something that I want, and that's certainly something that you can't call quality of life. And it really is about quality of life. Fix the cause. The body is amazing. The body is a self-healing, self-regulating organism, needs no help, just no interference. And what we're really good at is identifying where there's interference, fix the interference, and sit back and watch the miracle that is the body start to correct itself, because it is designed to adapt, it's designed to heal, it's designed to keep you alive and functioning at its best as long as you're not interfering with it. So let me close by saying this. AFib is a nerve issue, and every nerve issue comes down to physical and or chemical interference. AFib is not a muscle issue. The muscle is a result. It is a nerve issue that comes down to either direct physical nerve interference affecting the vagus nerve, or it is a chemical interference. Most likely, one of the first things you got to look at is you got to look at what's happening with your electrolyte balance and the fact that you are, even if you are getting enough electrolytes in the first place. Hope that makes sense. I hope that you share this, because AFib actually impacts 2 million people just in the United States alone. And I sure as heck know what they're doing about it, which is more drugs and more surgery and no hope. So share this with other people. Hopefully they have an open mind to be able to look at it, to be able to listen, and to be able to be open to a different perspective when it comes to something that 2 million people in the United States are actually suffering from every single day. And guys, by the way, if you are from the Chicagoland area, yes, we are opening up new patients. So in the Chicagoland area, our next event is the Approach to Inflammation. So if you are interested in working with me, please make sure you get registered for us. The reason why we do that, guys, is when you come to it, everything will make so much more sense. So when I say you need this, this, and this, you're like, now it makes sense, and now I understand it as well. Guys, sometimes I just don't have time to sit down and explain everything and every single detail, which is kind of like, going to the auto mechanic, and the auto mechanic says, well, here's what's wrong and I'm going to fix it. And you say, well, I want to understand all of this so that I can fix my car by myself. So guys, sometimes I'll say you need this, this, and this. Here's what you need to do. Let's get to work. But you'll understand what the approach is when you're coming to inflammation. Guys, one of the biggest things, we had a guy today hurting so badly. I said, nothing's going to get better unless we handle inflammatory triggers first. Nothing will heal in a state of chronic inflammation. And that's the first place actually that you need to start. So if you're from the Chicagoland area, guys, all you need to do is go to the top of the page to our Eventbrite page, and you'll see that our next one is April, I want to say 12th, which is a week from Tuesday. And get registered for it. It's at 6:15 and it'll last until about 7:30, and then we'll give you the opportunity to be able to register as a new patient and be able to work with me especially. But we'll answer a lot of your questions so that everything makes sense. And I only want you to become a new patient if you are serious about getting better, and you're serious about putting in the time and putting the effort and your resources into changing and revolutionizing your life and your health, obviously for the better. This is not, we give you one herb and everything is just going to be magical. You do have to work on it. I will provide the direction. I will provide, with you the knowledge, the expertise. But at the end of the day, you're going to have to want to change and transform your life. So this is going to be April 12th. 6:15. You can register on the Eventbrite page. I'll actually be coming back at that point from Orlando, Florida. So guys, I actually leave on Wednesday. Make sure you stay tuned, because I'll probably be going live from Orlando, Florida. I am going to be speaking for the Wellness Way on Saturday at noon, and I'm going to be talking about the adrenal glands and inflammation and why most people don't have adrenal fatigue. They're inflamed, and you have actually as a result what's known as adrenal down regulation. So I'll keep you guys updated and posted. Hopefully I don't have any problems with flights, because a lot of people are having problems with flights going down to Florida. But I'll keep you updated. Make sure you watch our page. Also watch our page and Dr. Nathan Thompson here on Facebook. Also Dr. Nathan Thompson on Instagram. And then also Dr. Nathan Thompson on TikTok, because occasionally I'll do some short 1-minute videos that'll give you just some tips that you can do that hopefully you'll find a lot of benefit. So guys, be well. I hope you have a great, great night. And we'll be catching up with you soon. I'll probably talk to you next when I am in Orlando, Florida. So guys, be well, be blessed. Thanks for all your shares. I appreciate and love everyone. We'll talk to you guys soon.